camp. It's kind of like school, but it's more informal, and there's plenty of bugs and rashes to go around. So with that said, I wanted to run through a couple of conference etiquette. We'll be talking about information security, which is somewhat apropos to kind of kick off camp, right? It's about the rules and what is going on at a macro level in healthcare. But the camp rules are the following. We will be recording. So please use your camp decorum on your question and answers. You can go ahead and pin the speakers. You can see Taylor in the upper left and myself. And by all means, go ahead and pin. Number one thing I think is mute. I think we're defaulting everyone to mute. But if you somehow find yourself off mute and you go off on a bio break, I think that kind of disrupts a little bit of the conversation. So please mute and then ask questions. I mean, this is meant to be educational and informal. And so we're going to be using the question and answers. If we don't get through all of the question and answers, we're going to do our best to kind of document them and then recapitulate them afterwards. So we'll be sharing out the link to the recording, as well as question and answers, and then kind of our context. Again, the spirit of this is to disseminate education, kind of debunk and clarify questions around thematic cores that are facing healthcare and life science, and kind of create a camaraderie that is always ever present with camp. Like always, just like camp, this webinar will probably be a little buggy, so we apologize if there are some Wi-Fi lagging or audiovisual fun. With that said, why don't we go ahead and we'll meet the inaugural speaker, Taylor Lehmann. He's the director at the office of the CISO here at Google Cloud. But Taylor, we've known each other for a while. Kind of explain to everyone a little bit about your background, why cybersecurity, what wakes you up at night, top bunk, lower bunk, go. And you're mute. So you just failed the number one task.
I was just listening to my camp counselor. I didn't want to get, demerits or had to go do some push-ups or some punishment that you would come up with. But thanks, Will. This is a lot of fun. I feel like very nautically themed right now too, which is kind of exciting. I hope everybody is getting ready for
my background is more like Blues Clues than I think camp motif, but we'll work on that.
Yeah, it's working great. So hey everybody, thanks for being here. I know everyone's got a busy day, it's a busy time of year, especially for someone like me. I have 3 little kids who I'm sure are going to make an appearance today because they get out of camp and they immediately come into my office and start screaming. So just forewarning everyone, we might have some guests joining us. But I am Taylor Lehmann. I'm a CISO. Prior to coming to Google, I was the CISO of a large health tech company called Athena Health, and have worked in healthcare settings all the way going back to 2004. I decided that I wanted to be in cybersecurity very early on in my career, as more of a sort of future-proofing decision that I had made. I recall I was consulting a large health plan out here in the Boston area, which is where I live, and some 4 or 5 really excited IT guys came running up to me and handed me a big stack of paper and said, "We did it. We're secure." And I said, "What do you mean?" There's like, "We're HIPAA compliant. We have our policies. We're done. We did it." And I thought, man,
mission accomplished.
I was like, banner. This is the industry for me, right? That was the moment I knew, because that's all you had to do was print out a bunch of paper and you could get a job. Obviously that's not the world we live in today. From that moment all the way sort of through to where I am today, always been really focused on healthcare. Always wanted to sort of keep pushing myself, my organizations that I worked for, and even Google to do more in this space. feel very, very passionately about unbreaking a lot of the things that I think are broken, and working at Google gives me an opportunity to do that. And a little bit more on that. So for the last year and a half, I've been responsible for all product compliance across Alphabet, not just cloud, but all of our products, as the health security officer for the company. I recently relinquished that role, but I now spend almost all of my time working on internal engineering projects to make our platform more secure, meet more regulatory compliance guidelines, build higher quality, better software for organizations in healthcare to use and consume easily. And the other piece is I get to work with some of the folks who are on this call. And I see Jeff Briner. Hey, Jeff. I get to work with folks like yourself, thinking through, how to get onto cloud faster, more securely, how to address threats and toil, with doing security jobs, and really just trying to make sure that everybody that I get to work with from a customer perspective takes full advantage of the investment that Google has made in securing this platform, which I can say from working here, it's pretty remarkable getting to see some of the stuff we do. So that's me. Nice to meet y'all, and I hope I hope that was what you were looking for. I mean, it is camp, so
it's a solid C effort, but you'll have chances to improve over time. So lots going on, and I know, all right, hey, in 30 minutes talk about cyber, but are there kind of salient points? We have a very, very kind of diverse audience, I think. What are those global trends? What is kind of going on through your lens? We see that a lot in the news. But is this different? Is it accelerating? Is it worse? Where are we in the, in that kind of spectrum?
Yeah, I mean, healthcare is, depending on where you are in the world, my answer is going to be a little different. But a little bit of news reading. Many of you, whether you're in the U.S. or not, you may have heard about some of the two largest cyber events, I want to say. Not just to affect healthcare, but really, in the history of, cyber, have occurred earlier this year with the unfortunate events out at Change Healthcare earlier this year, and then most recently with Ascension, and then in the UK a couple of weeks ago we had Synovus, all victims of at least criminal, maybe state-sponsored organizations looking to disrupt the availability of care delivery, and we've known that the availability of care delivery has been a challenge for organizations throughout the world for a long time. These are systems that are complicated, that are expensive, that are old. There's a handful of characteristics about the technology used in healthcare that make it really interesting to groups who want to profit from disrupting it. And that's been something that we've known about. We saw lots of examples of how bad things could be early days of COVID. Things have quieted down a bit, and now the volume's been turned way up. I like to say it's criminals will be criminaling is the quote I use, because that just explains there was a period of time earlier years ago where we thought criminals were above attacking people, basically. And when you attack a hospital system in a rural community and you take it down, you don't just affect that facility, but you affect the communities and the people who live in those communities. And so if you think about the impact, and then of course the bad guys don't care about the people impact, they just want to get paid. If you think about when you put thousands of people at risk because their healthcare system can't serve them, that's tremendous leverage to get paid, and we're starting to see that being used more and more. So that's one big one. I spent a lot of time talking to companies about resiliency off the back of that issue. So how do we design systems that work globally, that can support real-time, patient-critical, safety-critical workflows, using cloud technologies, not just because cloud's theoretically better, faster, and there's more of it, but because it's got the ability to withstand and in some cases resist events that affect its integrity or availability. So for example, if there's a way we could build a diagnostic equipment that could survive a ransomware attack and still conduct CT scans How do we do that? Like, those are the problems that I'm working on more and more at Google, and trying to help people architect systems that not just stay up and running if a zone or a region goes down, but actually can be more robust in the face of attacks. So resiliency is key. I'm doing a lot of internal research and talking about this as well. And then finally, the thing, if I had more time, I would spend more time on this, but I'm trying to chart the path to building quality software on Google Cloud. So we've got all these really cool things called LLMs, and generative AI is pretty popular. And so, yes, assuming we can secure it, which I know we can, then how do you use that in a clinical setting in a way that meets not just privacy and security, but also quality guidelines that are really important to organizations like the FDA and others. And so right now, almost done writing a guide on how to do it, how to build quality software, how to build a production system on Google Cloud that meets quality guidelines and would accelerate the pace at which people are building secure medical devices and getting them into people's hands. So that's really important to me, is that, back to my earlier point on how do we help people take full advantage of the opportunity? It's sometimes it's just we have to explain what it is and how do you think about it, and that's probably the thing I spend most of my time doing, but in these three areas right now.
During the emotion of any of these attacks, whether U.S. or across the globe, there is a lot of emotion, right? Because at the end of the day, I've been practicing physician and have seen firsthand what it means when you don't have access to the critical information, and how that is so unbelievably disruptive, scary, and ultimately dangerous. Lots of emotion, but there's also this irony of misinformation and confusion of what do I unplug and what do I do and how do I actually act in a cyber event. As a non-CISO person, and there are probably more non-CISO people on this call, what's their role and responsibility of getting good information, high quality information, ensuring that we're not propagating, tropes on social media or LinkedIn? We saw a lot of those. Like, what are your kind of three pearls of in the moment? What do I do? Because there's a natural inkling to want to help and to want to kind of pontificate.
Yeah, I mean, this is a quality of working in healthcare that we both gain so much from and suffer so much from, which is wanting to be active in the face of, threatening events, wanting to natural inclinations is to help, and I think that's true. So thank you for this question, Will. This is a really important one because this was consistent with the three events that I mentioned a moment ago. Was that when these things happen, when systems go down due to an attack or for whatever other reason, of course there's always the peanut gallery that is offering takes on why that happened, blaming people, blaming specific things. Really, almost always, none of that is true. And what was problematic about the first two events that I mentioned was that the initial news coming out, and I can prove this now through just pointing you at different articles that said different things at different times. But the advice to customers on what to do, if you were a customer of Change or if you were a vendor of Ascension, the advice of what to do immediately following that came out was not from those organizations, and it turned out that it was wrong. In fact, in the case of Change Healthcare, the initial guidance that was put out, or maybe it was one of many different points, but there was a problematic advisory sent out. I wouldn't say who, but basically saying disconnect all your systems from Change immediately. Disconnect, thinking that if you were connected to Change Healthcare, somehow Change's problem would sort of transfer over to you. And I don't know what the medical term is, but this is me, getting sick because you're sick, right? And the transfer of illness is unfortunately not possible over API calls over the internet, or yet we've seen it, and yet that was the advice that was being sent out. And so what ended up happening was organizations that took their advice, and we're guessing it's in the hundreds or thousands, we don't really know, but not only did they delete the connection that they had to Change, but they had to wait weeks, if not months longer to get it set back up again when change was back online. So this advice, we call it denial of service attack, which basically means an attack that takes your system down. The advice of a well-intentioned person was actually a denial of service attack on all of the victims or all of the customers of Change Healthcare. So it was kind of like a double whammy. And that's that example is really important because similar advice and suggestions were made post-Ascension that were also wrong. Certain takes on what happened in the UK were also wrong. And not just that they were wrong, but people did stuff in response to it, and they hurt themselves. So what do you do? I think is the answer. Well, the thing you do is the source of truth for cybersecurity threats in healthcare is an organization called the Health ISAC. Stands for Information Sharing and Analysis Center. It's the best money spent. I mean, I'd love to say you should spend it on Google, but if you're in healthcare and you want to be decent at security, you should join the Health ISAC, and you should work with those organizations like the ISACs. There's one for every critical infrastructure sector, and leverage their platform and obviously push for quality, but leverage their platform for advice as opposed to reading the news or trade associations or other organizations that might actually have incentives to create even more havoc in the event of these types of things. But I think establishing that source of truth for threat information, like we're always going to need better truths and more accurate truths, but there is a trajectory for how that gets done today. And when people ask me what should I do, I'd say get good data before you do anything. Ask questions, understand the problem, and then check with the experts. And right now, the experts in this area are the ISAC, and obviously folks like Google. We have organizations like Mandiant that help us with that too. But that's hopefully not too long-winded of an answer. Well, go ahead.
No, I like it. I like your. It's almost like you said. What's the clinical equivalent? We're going to go coin Munchausen by proxy for cyber events. So
yeah.
You can Google that one.
The movie.
Yeah, strong work. Let's, a lot of health systems and organizations, are operating on razor thin grocery store margins.
Yep.
And, gosh, we've got to deploy dollars because we need more nursing staff and we need to support our caregivers and frontline and kind of this risk benefits analysis of where do we deploy, and especially for rural hospitals. So tell us. I know there's been a partnership and an announcement for rural health with Google, Microsoft, others, which is the right thing. But explain a little bit about that and what that means for the entire ecosystem.
Yeah, it's actually super exciting. It's one of the reasons why getting to work here and work on this stuff is for me the appealing, and it keeps me here and motivated. Back in May, we were invited to work with the National Security Council of the White House to establish a program that would help organizations like critical access hospitals in rural communities, especially those serving underserved populations or under-resourced population, of which there's like 80,000 if you count the clinics and the hospitals in the US. There's about 81,000 of these. But basically, these organizations were under the focus of the White House due obviously to the focus on healthcare, but also the fact that when these particular organizations go down, we have that catastrophic effect where hundreds, if not thousands, of people and families are affected too. It'd be one thing if you were to come into Boston, and I won't throw out a name because I don't want this to happen, but if you were to take down one of our major hospital systems, chances are and if it was deemed to be unsafe to be in the hospital, you could just be transferred to another hospital within, I don't want to say, because Boston traffic is awful. So like a mile is like 3 hours.
I believe you mean it's friggin' awful. It's friggin' awful.
Wicked is what we say.
Wicked.
But the reality is you just get moved, right? Like worst comes to worst, computer systems go down, you get moved over to a new system. When that happens in a rural community, you have to get in a car and drive and pray to God that the traffic is light and that you can get there. And oh, by the way, that they have room and specialists that can treat whatever thing that is. And if you have a brain injury or stroke, you don't have a lot of time to make that transfer too. So, there's real life consequences to taking some of these communities down. And that was the goal of the NSC and the White House. That's also been a goal of Google's now. And it's awesome to see Microsoft too. But the program that we just announced last week is focused on how do we get to those 80,000 providers or in facilities and put the tools that we know work, like the ones that we have here. How do we put like Google's tools into the hands of these organizations and do it in a way that they can consume it and use it? So not just give them free stuff, but actually help them implement it, integrate it, and use it in a way that actually adds to their business. So I'm leading a team right now at Google where we're actually going out and doing this. We just got started, but we're taking products like Chrome, Workspace, and Chrome is a sneaky, probably most sophisticated security tool that we use at Google. But Chrome, the browser, Workspace, which is our collaboration platform, Chrome OS, which is a secure operating system, which is appearing more and more in healthcare, which is great, and some training and other resources from our Mandiant team. And we are working with these institutions directly to help them up-level their security, join the Health ISAC, which is something I mentioned a minute ago, so that they stay on top of threats. And our Mandiant colleagues are actually working with the Health ISAC to up-level their game so that they can take on more and more of what the community needs, to increase its resilience overall. So we're doing a lot there. I'm plugged into all those projects, and it's a really exciting time to be working on this stuff because it's going to make a big difference, we think, and I think.
So one of maybe a naive question is, I'm a software developer, and of course I'm going to build my healthcare application with security in mind, and security by design and by default. But is that necessarily true? And what do those words actually mean to you? And what's the reality when you see the entire ecosystem of health applications and systems?
Man, it's like we planned this talk well. Because I have answers. So it's amazing.
I'm riffing. I was going to ask you what you think about pickleball.
Oh,
that's a fair one.
Yeah, it's like what did I say the other day? It's like a hobby masquerading as like adult exercise, but it's more like a hobby unless. Yeah.
Before we completely disenfranchise half the people on the call.
What's summer camp?
Yeah. So security by design and by default. It's a great bumper sticker, but what does it mean?
Okay, so sticking with the healthcare example, and this is true because I was a CISO at a large health system in Boston, and this is how every product would show up. Yeah, we pick it up off, well, not every product. Some of them, folks like yourself would go to conferences and get samples and then bring them to my hospital and then plug them into the wall, and then it would take down like the wing because that thing was doing DHCP or something goofy. But basically, like many products that show up at any business, but keeping with hospital, including some cloud services and some cloud providers, show up, and the developer of the software has basically said, hey, I'm gonna give you this thing, and your job is to become a master of it overnight and figure out how to secure it, and we'll give you as many bells and whistles to secure it as possible, but it's up to you to decide how that's best done. Which is a hard thing to do, especially when you've got 50,000 different types of pumps and hundreds of different cloud services and 15 different operating systems and a huge variety of technology entering your doors every day. It's hard to become an expert such that you can then configure that stuff to be secure and then use it. And so there's been a big push. CISA just announced the Secure by Design program. Google was one of the originators of that program and one of the first to sign up for it. But the idea is, it's twofold, let's stop doing that and start shipping products where all those defaults are turned on. So instead of hardening your software, the first step is to loosen your software, meaning loosen the security parameters so you can actually use it, as opposed to learn how to turn them on and then turn them on and keep them on. So we're actually call that element our secure by default focus. And so all cloud services at Google are undergoing this program right now where we're re-looking at how we've done this and continuing to turn defaults on wherever we can. So things like encryption are on all the time. External network access to cloud services is off by default. You can turn it back on, but we help you keep it off so it doesn't get hacked immediately. Things like that. Our secure by design push is really around using threat modeling and other sort of more sophisticated ways of using and then breaking software, using technique like those to understand where potential weaknesses in technology are, and then solving them in the architecture, in the service, without necessarily you having to do anything. So I can see a future where every cloud service that we run is available globally, to the extent you want it to, because we've designed it in such a way that it can support and survive an attack on any sort of location, because it's been designed securely and it's been designed with that potential in mind. So secure by design is a really important design principle that we've adopted here, and then that secure by default push is really key, because those two things together stop my problem that I had at the hospital when I'd have to take stuff off the loading dock and be like, what do I got to do with this? You know, if we could ship more technology that had the security defaults on into folks like yours, into your hands, and didn't force you to be a security expert, like, I think we'd make a huge difference in the world, to be honest with you.
Yeah, no, my former chief compliance officer affectionately called the physicians the STDs of the hospital IT infrastructure, because we would come back from a conference and a trade show and deploy app RS and take out something. So I am your worst enemy, and I apologize for that. Sleep well. So I wanted to touch on a little bit about there's a lot in the press around kind of deepfakes and generative AI, and are you seeing that kind of I mean, is that one of the biggest threats, or is it the lack of security by default? But are phishing scams going up, and is that a correlation with the uptick in cyber events? And are you seeing a downside on how powerful AI is in terms of its ability to spoof and imitate?
This is a very complicated question, Will. I'm glad you asked.
We'll make it simple.
I'm glad you asked it.
Yeah.
I'll do my best. So
make it like pithy in 3 minutes or less, please.
I can't. Yeah, I'm not British, so that'll be tough. I think the question you're asking around how are we seeing AI being used as a tool that bad guys are using with success. I'd say what we're seeing most of is disinformation, misinformation campaigns leveraging AI to take effect. Most of the activity, most of the behaviors we're seeing like that operate at global scale with like AI at the middle are those types of campaigns. So this is like political influence, influencing elections, things like that. We're experimenting with AI to do reliable vulnerability discovery, meaning we can use an LLM trained on software security to spot problems in software and then tell us about them, and then maybe even generate new code that fixes the problem. So we're using those tools. We're seeing those be now those are tools that can be used for good and evil, if you think about it. Not just how do I. We like to say we're going to find the problem and then generate the fix for it. Some people just want to find the problem and write software that will exploit that weakness. And of course, we're seeing that, but not at scale, right? You mentioned deepfakes. I think deepfakes are an interesting problem. I'm not sure that current mechanisms we have today are good enough that are going to really solve it. And what I mean by it is like the authentication issue that has been created. If you can fake a picture or fake a voice, you can get into a lot of places you can't get into today. And I'm not sure that the mechanisms that we have today to authenticate people are going to survive deepfakes in the direction it goes. We're going to start to see, I think, more sophisticated means of making sure that I know you're Will and I'm Taylor. And I think the answer is somewhere in just it's an encryption problem. We're gonna stumble onto it. There are thousands of researchers working on this every day. We're gonna make progress, but I think this is an area that people need to keep an eye on and really should always be and should have always been focused on how how do we make sure that people who are in our systems are the right ones and not the wrong ones? So hopefully that is enough of that answer in 3 minutes or less. But I'm actually very optimistic on AI's use as a tool for defenders. I think right now, I think right now it solves big issues that makes people more productive and effective at finding and defeating threats. So I actually think it's trending in a positive direction for us and not in the same direction for the bad guys, but we'll see.
So we have a question here. Taylor, can you elaborate on threat modeling practices and tools, zero trust approaches, proven successes in your company?
Sure. I think threat modeling is an awesome activity that everybody should start doing more of, and if they're not, they should start.
So for the layperson, tell me a little bit more about threat modeling, because my mind went left on what a threat model is, but
yes,
perhaps you could articulate what that is.
We might share attentional diagnoses here. Well,
yeah,
a threat model is think of it as draw a picture of your system. So you've got an application, you've got a server, you've got a database, you've got users, and understand the data flow of, say, a request a user might make of that system, and follow the data through those components. And then when you have your picture and you understand the flow of data, start asking yourself questions like, what could go wrong here? How could I spoof the system to give me a response of something I didn't ask for? How could I extract data from the system, steal information from the system? And walking through those steps, you then ask yourself, well, is there a control here that would prevent spoofing? Hey, maybe the username and password is the control for that. And maybe encrypting links between applications and databases would prevent a certain threat that might focus on stealing information off the wire. But the activity is really, it's really about understanding how your system is designed, and then undergoing some theoretical attacks on different components of it, and seeing what systems you might have deployed that would defeat that threat or not, and then understanding where your weaknesses are. So it's kind of like a simulation a session of attacks, but you can never do too much of this because the attacks always change and there's always new vectors. There's a lot of different disciplines at Google. People are free to threat model in ways they think are most effective. So what I'll give you as my opinion is Adam Shostak is an awesome author. He wrote a book called Threats, and he also wrote a book called Guide to Threat Modeling. And in his book, he talks about the STRIDE acronym, which stands for spoofing, tampering, repudiation, information disclosure, denial of service, and somebody give me the E. But basically these are all different types of threats that one could use in a modeling exercise. So threat modeling is really about finding vulnerabilities. And then again, generally speaking, threat model everywhere, but if you're going to do it anywhere, threat model a system before you deploy it, and then if you can, and regularly thereafter. Zero trust approaches, that's a very complicated topic, but I think back to the topic we were talking about before under deepfakes, the secret to getting to really any higher level security mechanism like zero trust, for example, really depends more and more on identity and your identity and our ability to understand who you are so that we can assign you access that is commensurate with your job responsibilities, and that we can understand activity and behavior that you're doing and track it back to what we think you should be doing. All starts and stops with identity. If you talk to any hardcore security person, they'll probably tell you the hardest thing to do in security is get control over identity because it's so dynamic. In the hospital system I used to work with, we had employees, we had students, we had residents, we had attendings, we had researchers, we had all these people coming from inside and outside of the organization. You can imagine it's really hard to figure out who was who. But that problem is, and if you can crack it or at least get better at it, it allows you to unlock things like zero trust, which instead of relying on firewalls to keep networks secure, we tear the firewall code And we focus on every time Will wants to access his payroll system, we validate that Will is who Will is. And believe it or not, at Google, we've implemented this kind of security approach for all of our services, and so we don't have things like firewalls here, right? We don't use VPNs. These are traditional security controls. I'm not saying that they're good or bad, but these are defenses that people have been sailing through for years, and yet they still make up what most companies would say is their most important security control. So getting to zero trust, whether it be network or software or hardware, there's a zero trust flavor for all of it. But getting to zero trust is really an exercise in understanding who's accessing your system, and then understanding what your system is, and then making sure you've got some, principles around authentication built around it and encryption. So,
what did Zero Trust think about single sign-on?
Zero Trust would be okay with that. I mean, I could go ask him later. He's hanging out in my pool right now. No, I mean, I think look, like separating authentication from authorization is a component of a strong zero trust model. Single sign-on's fine, I suppose. It keeps life easy. Although you need multi-factor authentication and whatnot. So there is that, and I tend to see people getting single sign-on and MFA confused a little too often, to be honest with you. So which they are completely unrelated things.
Well, we're coming up on time. I want to ask just kind of what actually, are you optimistic, pessimistic, worried, scared, inspired? What's, where are you on the more emotional roller coaster that is healthcare and healthcare cyber? But, tell us the things that, where you are and what you're really kind of passionate about.
Well, I'm at summer camp, so I'm getting up early for polar bear swim tomorrow. I'm pretty excited about that.
A little vitamin D. It's good. You guys gotta get out of your subterranean, CISO basement. That's good. It's called the sun.
And I have the shirt on because it's America's birthday in a week. So I'm gonna likely go down to Pennsylvania and pick up some illegal fireworks. I'm kidding. This is recorded, right? Yeah. Okay, we're gonna cut that.
Yeah.
Anyway, I'd say generally I'm super optimistic. I think that there is a lot to be said about the progress we've made in like the last 12 months. Like if you had asked me how you feeling about the future, I'd be like, but like in the last 12 months we've undone some rulemaking that was really important around securing medical equipment, medical devices. We've increased accountability for that stuff, which I think is important. We're floating new rules in the U.S. around regulating healthcare security less focused on just like confidentiality of data, because like that hasn't worked, and more focused on availability and integrity of systems. And resilience, really, which is like something personally has been very important to me. It's like we got to stop saying we're done when we've made sure that nobody can get access to the data, because like I said, the bad guys are sailing through our policies, and they don't care. And confidentiality is cool, but like taking a system down and not giving it back to somebody gets you more money, it turns out. So we need to focus on that, and I think the rulemaking is going in this direction. I also think companies like Google and Microsoft and others who are getting more and more awareness into this space, like they're actually going to these facilities and being like, oh, this is what it's like running a rural health hospital system. People actually getting out and going out and seeing and experiencing these things, because if you haven't been to one, you all should go and compare it to your academic medical center. You'll see they're two very different things. We're starting to see that level of time investment and corresponding technology investment. So like, while I don't love that it took so long, and I have personal thoughts and feelings, and I'm free to talk about them separately on what role I think organizations like Google and other tech companies should play, I would say overall, when I look at it, I think it's really positive direction. And the conversations I'm having now versus the ones I was having a year ago are uplifting, motivating, and I frankly and you know this, Will, I'm trying to do everything I can to get everybody working in healthcare security because we just need more people to do it. But overall, thumbs up from me, on where it's going.
Well, I think that's actually a perfect. We got one question right now. Taylor, your opinion on using national state type resourcing model to hurt the hacker community, i.e., hurt the bottom line of the cash flow crypto banking systems.
I'm not sure I understand the question. I would say I love hackers. Hackers are good people. We should always love hackers. We should put criminals in jail, but not hackers. Hackers are the good guys and the good gals. I think we should be looking at payment systems as one potential area of focus, and other types of deterrents that are more I would say that. But I think we need a combination of looking at payment infrastructure, political deterrents, as well as capabilities to respond in the event we need to respond. But there's a lot of ways to take apart the ransomware apparatus. Taking illegal payment systems down is one of them. So hope that answers the question.
That's great. And again, just a reminder, we'll make sure we go through any of the Q&As and clarify. We'll put links, including some of the topics mentioned and resources. Taking off we got another question from your discussion with public policy folks, some of which are on the dais here. Do you think you'll see ransomware payments made illegal in the US or EU?
So hey, Tommy, thank you for the question. It's good to see your name. I know Tommy. I think it's the same Tommy. Yeah, there he is. I don't. So this is a tough one. I'm kind of like on the Kevin Mandia side of this question when he gets this question. And not to quote him, but it goes something along the lines of whether to pay or not is a very personal decision and an important decision. And one, I would struggle to see positive effects of having it being taken away from people. And the example I use is, and this could happen, if you have an implanted cardiac device that's pumping your heart and keeping you alive, and for some reason somebody left the Wi-Fi antenna on that thing on, and Windows CE was the operating system on it, and somebody popped that and then sent you a letter and said, pay me $100, right? But that was illegal or not. It would just be like, well, I'm paying it anyway. There's certain situations where you need the option to be able to extricate yourself out of certain situations. And I think if you were to make it completely illegal, one of two things will happen. The bad guys who we know don't care will just say, okay, enjoy your pacemaker, right? Like, have fun. And you'll have to go and experience a replacement, which carries with its own risks to, that getting that fixed might kill you, that sort of thing, right? So I think it's a sensitive topic. I think it's one that requires a lot of thoughtfulness. I don't think any bright line is going to fix that. And frankly, I'd rather focus on how do we build systems that can't get taken over and owned, and life safety components are affected by a hack. Like, I think that's a more important problem for us to solve. Like, why can taking that over result in your death? Like, we should be focused on that problem and make it illegal to create software or technology that allows those two things to
create that vulnerability.
Correct. So
absolutely. Well, listen, Taylor, thank you so much, to be the inaugural, but on a sober note, Taylor is one of the most remarkable humans I've had the chance to work with within Google, because it's not around the technology, it's not around kind of all of the cool toys, but it is ultimately about the patient. It's always about who is on the other end, and passion, empathy, and mission is so real with him. Aside from his choice in dress wear. One of the most genuine human, and I know, it speaks to the cyber community. The men and women who do this, we thank you and we applaud you. And I think it's such an appropriate kind of kickoff to the summer camp. So thank you so much for joining. We will have the link out. And again, here's the following agenda. We go to ambient listening. So we get to chat with docs and celebrate the primary care physician who's actually looking at you and not glued to the keyboard. A little digital pathology, right? So brush up your H&E skills, understand what it means to look under glass at pathology, but the kind of a new emergence around AI and the whole space of pathology. Then keeping the theme of imaging, we'll talk to the CEO of RAD-II around radiology. It's oftentimes cited as the place where kind of AI has been really deployed at scale. And then lastly, kind of talking about research and collaborations, life science, and how we think about synthetic data, et cetera. But with that, we say thank you. And again, these serve as an educational opportunity. We share, we learn. Oftentimes we are learning more from you all than vice versa. So thank you so much and hope to see you in a couple of weeks. Take care.
See you, folks. Thanks.